Hello, everyone. Welcome back to the live stream. I'm John Munitz. I am the president of the People's Basics. You might be wondering to yourselves right now, why am I all in this getup? I will tell you the reason why I'm in this getup is that it is freaking cold. I want to be a little warm right now. So I hope you can mind the silliness of the outfit. I will be eventually on a smaller screen. You'll be getting to see Andrew Yang's platform instead. But we're on to our third part of the breakdown of Andrew Yang's policy platform. We've been spending the past 2 days going through the policy platform in depth and really talking through it. And we have his last 6 policies left to go through, which include doing vaccine distribution, addressing the mental health problems in New York City, delivering racial equity in our healthcare system, doing green reinvestment into NYCHA, which is the New York City Housing Authority, doing an expansion of resident democracy at the New York City Housing Authority, and then the People's Bank of New York. So without any further ado, we're going to get into this, but I want to encourage you all along the way, please include any questions that you have about the platform. I'm going to be checking any questions that you have in between each policy that we analyze. But without any further ado, let's get into it. So first one, vaccine distribution. So he goes on to say, New York City is the best city in the world. Our healthcare infrastructure and public health strategy needs to meet the urgency of this moment. Access to COVID-19 vaccine is the key to getting New York back on its feet. New York has to be the number one place where all residents, regardless of age, race, life experience, immigration status, ability, and more, know that a vaccine is at their fingertips. Unfortunately, our city has failed far too many New Yorkers, especially those who are most vulnerable, in ensuring that vaccines are within reach at the soonest moment possible. Yep, we all need to have the vaccine. So let's see what he actually wants to do to make sure that that comes out. So immediate expanded vaccine access for the hardest hit neighborhoods. As the city is rolling out the COVID-19 vaccine, a one-size-fits-all approach has demonstrated negligent results for communities of color that have been hit hardest by COVID. To address that fact, the communities of color have been hardest hit by the pandemic. Anyone over the age of 40 who lives in the top 10% of hardest hit zip codes must be eligible to receive the vaccine immediately. The city must invest in hyper-local outreach and ensure there are vaccination sites within walking distance of the most at-risk communities in schools, community centers, and mobile sites. Expanded access must be coupled with on-site registration and vaccination slots reserved for same-day access to community members. And we're going to be going into this a little bit later in the racial equity portion, but he goes on there. I think this is very important, and we're going to go into this more and more over time as we go into that racial equity section, but he's right. This crisis, the pandemic, has predominantly impacted communities of color, specifically Black and brown communities of color. We have seen, for the first time in a long time, massive declines in life expectancy from particularly the Black community. They had been catching up in life expectancy, and from the past year, we've now had the average life expectancy of the Black community decrease by 2.6 years compared to the overall life expectancy decrease of 1 year. So he's absolutely right. This is targeting communities of color, and it's not because necessarily of the skin factor. It is because we have an economy that has a racial wealth divide, which makes it harder for these communities to be able to get access because they don't have as many resources in their community invested there. It also is distribution, which he addresses here, which could be potentially on racial lines as well. But a lot of the gap is just because communities of color tend to be poorer and therefore have less access to these resources. And that is systemic racism. But it's not that we're saying, doctors are saying, don't let the Black community have this. It's not like that. It is just that we are not investing the resources into their community properly. And furthermore, there are cultural reasons too. There has definitely been a little bit more skepticism of the vaccines from the Black community. And this largely is rooted in just a general distrust of government because, well, over time, government has not always been an ally to the Black community. And so they have this natural distrust of institutions of power that have repeatedly failed them over time. There are other reasons, but I don't want to necessarily talk on that. And for the whole community, I will let you all reach out to members who are skeptical in that respect. But there are gaps right now in willingness to take it where Black members of our communities are less willing to take it than others. So that is also a reason why we have not been getting enough people of color vaccinated, is because some people aren't trusting it. Let's keep going onward, though. Unfettered access to COVID-19 vaccine. A Yang administration will ultimately ensure that the city has 24/7 availability of the vaccine administered by trusted providers along with associated counseling in the languages that New Yorkers speak. We will make vaccines available at local doctors' offices, at safety net providers across the 5 boroughs, and pharmacies to reach people in communities beyond hospitals and vaccination sites. We will also make sure that those who are among the most vulnerable to COVID, including people who are in city jails or living in shelter, have access to the vaccine as soon as possible. This is great. I mean, he's absolutely right that we need to make sure that this is available to everyone, including undocumented immigrants, including prisoners, because guess what? A pandemic doesn't care if you're a citizen or not. It just doesn't. So we need to make sure that we really are building up this immunity by making sure that everyone is being covered. And he's right to also take this hyper-localized approach because people are not going to necessarily get the vaccine unless it's convenient for them. Like a lot of people might feel like they're on the edge, but if it's convenient, they're going to go get it. And so if we want to increase our margins of how many people get inoculated, you have to deliver it to where it is convenient for them. And so it can't just be these like hyper centralized points of location, because there's also going to be potential skepticism of like, do I want to go to this one place where everyone else is going? And it's all these people who are maybe having COVID and that's why they're worried. I don't know. I think there is some skepticism about having only a few locations because you don't want to have a lot of people potentially congregate at just a couple locations. And our hospitals are already being very overburdened. So in my opinion, you need to spread out where this thing is being set up and have these mobile sites. So I like that he is kind of going with this hyper-localized approach. Let's keep going. Repurpose underutilized businesses as vaccine distribution sites. Many New Yorkers cannot access a physical vaccine site because they are homebound. Others find the trip to the doctor's office or vaccination site challenging due to their work schedules, caregiving responsibilities, or comfort level. This is exactly what we just said. You have to make it convenient because it's really tough for some people to take time out of their day to go get it. Let's keep going. So while the city has began an ambulance service for those who cannot access transportation, this is not enough. Our administration will bring vaccine to New Yorkers in their neighborhoods and on demand. We will do so by reinvigorating shuttered venues, theaters, restaurants, and bars, repurposing them as vaccine distribution centers. We will provide direct funding for business owners to reopen and temporarily retrofit their businesses so they are sound for vaccine dissemination, while giving business owners the capital they need to open up when it is safe to do so. We will also rethink the use of mobile facilities, existing resources like mobile medical units that nonprofit providers make use of regularly, and more creative solutions like retrofitted mobile food trucks that are currently struggling for safe vaccine distribution staffed by qualified health professionals. So, like, I like this, and I have like some questions and concerns about it as well. It's like, I like that we're trying to get it, as I said before, localized, convenient, not so you have to all gather together. But like, I do have concerns about like having businesses be the administrators. It's like, well, I mean, are they qualified? I'm assuming you're going to have to spread out the doctors to move them to all these points. It's like, how do you know if we're having certain sites that are like not well demanded and you're wasting a professional and you're like holding some vaccines at that place? And I think like if you start expanding it to these like more like businesses too, these small businesses, I am less sure about it. Like some of the other things that he had suggested as areas like pharmacies, great idea. I think like those make sense, that they're kind of expected as a place people will go to get healthcare. And you got people who have some medical knowledge in those areas. So you could potentially have administration. But But I'm not sure about the businesses. I'd kind of need to know more about like the staffing side, like who is administering it. It's obviously not like just the regular employees the business owner has or the business owner. You're going to need someone there. So I want to know not just the physical supply of the vaccine, but of the people who will actually administer the dosages. Because I think that's equally important, because I don't want people to just be getting inoculated by non-medical professionals. I just don't think that is going to end up with good results and may lead to further distrust down the road. So that's something that I would ask of like Andrew Yang. It's not necessarily a major issue. It's just one of those things where it's like, I'd like to have it fleshed out a little bit more. And like, what are those criteria for a small business to be eligible? Let's keep going. Seamless sign up and universal data sharing. We will ensure the ability to sign up on a seamless web portal and by phone on one integrated platform that coordinates the efforts of state-run facilities like the Javits Center, health and hospitals, private hospitals, safety net providers, and independent medical practices, rather than multiple portals to entry and sign up. Our administration will also ensure that all individual providers can opt into New York City's vaccine tracking system. Great idea. The easiest way you make people feel like they are going to have consistency in data to know where to target is to make sure that data is available to everyone and that it is convenient for everyone to access that data. So, great idea. Let's keep going. Expand New York City's paid sick day laws to cover vaccination-related care. A Yang administration will clarify that our already robust paid sick and safe time can be used for all people to access and recover from a COVID-19 vaccine. Okay. I'm not sure the recovery time there. I don't love that language, but the idea is good. Like, that's what matters most. Yeah, people should be able to have a day off to go get vaccinated. As he said before, a lot of people are going to end up not doing that because, well, then they're going to have to take a day off and not get paid. And so we have to make it convenient, again, for everyone to get it. Let's keep going. Targeted community outreach and empowering trusted healthcare providers. Many communities, especially communities of color, are wary of the vaccine. Yeah, we mentioned that before. Given our country's shameful history of racist medical malpractice and medical experimentation on communities of color and immigrants, fear is understandable. I didn't bring up that point before, but that is true too. It's not just the political system that they might have mistrust in, it's also the medical system itself. Let's keep going. However, we must continue to ensure that healthcare providers of color are able to amplify their trust in the vaccine across New York City. Our administration will engage in an aggressive citywide outreach campaign to reach all New Yorkers, especially New Yorkers of color, seniors, New Yorkers who speak languages other than English, and undocumented New Yorkers. We will also follow the example of healthcare providers of color in Philadelphia to augment efforts to build trust for the vaccine in communities of color by trusted providers of color. I like this. And again, this is something where it's like you need to make sure that everyone is getting it. And so some people might say, but John, we talked about this yesterday. Like, this is just like hyper targeted focusing. This seems like something kind of like an affirmative action for vaccines. But this is different. This is public health. Anyone can get this. This isn't a fairness thing. We need to have as many people as possible who are vaccinated to be able to make sure that we feel secure reopening things. And so guess what? As I said before, viruses don't care if you're a citizen. Viruses don't care what color your skin is. They're going to infect you. They're going to do harm to you. And so the communities who have, frankly, the most skepticism of the treatment, the communities of color, the people who are most at risk from the virus, seniors, and those who have the most trouble accessing our existing systems due to language barriers or citizenship status, we need to target those people so that we can ensure that the vaccine is getting rolled out to as many people as possible. So I think, again, this is a good thing. Let's keep going. Real-time accountability and disaggregated data. A Yang administration will ensure real-time accountability for vaccination updates, including daily postings by neighborhood and demographic information of those who received vaccines. We must ensure that information is as transparent as possible so that our efforts to get all communities the vaccine is reaching all New Yorkers, especially communities who are at greatest risk. Yeah, this is important. Like, this is just kind of like saying, like, let's keep the data fresh, which is very important because it's like, it doesn't matter if you have congregated data if the data is just out of date. So I think this is also very important. Vaccine verification. Okay. Robust vaccination access and vaccine verification is our first step towards ensuring that New Yorkers are not putting the health and well-being of others at risk. All New Yorkers would be able to receive a vaccine verification on the New York City app, a smartphone application, as well as using a physical card. I like that he actually addressed that. We were talking about this the other day, that he wasn't talking enough about the physical card aspect. And I presume that's because even before his proposal, physical vaccine cards are given out. But I like that he just mentions it because some people are just not going to have a smartphone. Let's keep going. So, like scanning a ticket for entry into a concert or public event, every New Yorker will have the opportunity to display their New York City app or vaccine verification card that demonstrates that they have been vaccinated. As businesses emerge from the pandemic, New York City's ability to partner with businesses that have shuttered is one pathway to enabling businesses to open up sooner. So, my only concern on this is just like a little bit of a HIPAA concern of like having to display your medical information to private groups is something I'm not entirely certain on. But I mean, logically, like if we ignore the legality aspect for a moment, like just does this make sense as a way to help places reopen? Yeah, it does. You want to have the option, if you are a business owner, to say, hey, we can guarantee your safety while you're with us because we know that every single person in here has been vaccinated. And yes, the vaccine still has minor chances to allow you to continue to spread the virus, but it significantly reduces your likelihood. I think the going rates are something like 97% to say that you are not going to get actually infected with the disease, and it significantly reduces the mortality rate in general as well. So yeah, I think this is something that is a good idea logically to help assure confidence so that people feel more confident to be able to go out and do the activities they want, and that will recharge the economy, which in turn will give us even more resources to pump forward into solving this crisis. So my point being is that, yeah, eventually we do have to reopen the economy. Like, you can't just wait until 100% of people have been vaccinated or we will die economic deaths. It's just, that is the case. And so we need to help create a plan to transition in between having that 100%. And furthermore, even if New York City does perfect vaccine distribution and gets everyone inoculated, you still need to have that verification from people out of town. Like, they might not have been vaccinated, and we want them to still feel like they can come into our area, because that's how you also recharge the economy, because so much of our economy is based off of tourism. And in turn, this is needed. We need to have a way to not just inoculate people, but have the trust that they've been inoculated. Let's keep going. This is the final part before I turn to your question. So, learning from our past, planning for our future. Within our first 100 days in office, the Yang administration will release a public health playbook for New York City that gathers the best practices in learning from the COVID crisis to prevent and respond to future pandemics and health crises. Okay, so let's see. Does he have a... Nope, this just kind of sets you to the top of the page. I was kind of curious. Okay, so that is his vaccine plan. I think generally, like, this is a good plan. HIPAA concerns aside, I'm not a huge HIPAA expert, but I know from having to do some HIPAA courses when I worked in a hospital setting that this could potentially like have some implications there. So I'd love to know more, but I'm not a legal expert, so I'm not going to answer for you all if that is legal or not. But that is my only thought. And I think Yang also needs to like kind of like mull over and plan out and be very like detailed and sure on proposals he talks about regarding the vaccines. Like I remember he had one moment, how long ago was it? I want to say like early summer 2020. He made this one post how basically people in the army should be potentially willing to like volunteer to get the virus to make sure that they were immunized and can continue to do their work. And that received a lot of backlash for using certain people as like essentially guinea pigs. And it's just, then he also got the backlash from, frankly, a lot of the conservative media when he released this plan, basically them saying, oh no, this is like Nazis. That's obviously stupid. Like this is not a Yellow Star equivalent. That frankly is very offensive that they would even make that comparison. But I do think it shows that when he's making these policy proposals and talking about them, they can't just be very casual, like, oh, I this is just a thought I had. Like, what do you guys think? It has to be like really detailed and very serious when you're talking about these issues. So I hope he can kind of strike that tone a little bit. That being said, we're going to go to our next policy, but I want to make sure to see if there are any questions in our chat so far. No, there is not, but I would like to say hi, Brendan, and to remind everyone, go share this video out with people so that more people can see the breakdown of Yang's policy platform. But without further ado, we're going to go into our mental health impacts. Okay, so I guess this is technically kind of specific to COVID-19. I do hope that when we read through this, it is a little bit more generic because there were plenty mental health crises pre-pandemic too. The crisis simply exacerbated it to a very high degree because it's made a lot of us isolated and economically anxious. So let's read what he has here. Okay. COVID has had a devastating mental health impact on residents of New York City. Death, economic hardship, loss of experience, survivor's guilt, and uncertainty are commonplace for so many New Yorkers. Yeah, he covered a lot more there than I even mentioned of why mental health got exacerbated. Let's keep going. While equitable access to the vaccine is central to our recovery, we must take a holistic approach to our city's recovery that includes investing in mental health services with a focus on the needs of young people and improving our city's crisis response system. I love this, and I don't know why, but it like reminded me of how like so many people really look at Yang as if he's just like a silver bullet guy or like a gimmicky guy, and he doesn't think about how all these systems really work together. And that's just so untrue. Andrew Yang is a very holistic thinker, and he understands the downstream implications, and that it's not just like a silver bullet, we just got to do vaccines. You have to try and address the whole aspect of the issues that the crisis caused. And mental health is definitely one of them. And I like that he mentions that we must take a really holistic approach to recovery. Let's keep going. Expand the number of social workers, mental health providers, and school-based mental health centers in New York City. Young people will return to New York City schools forever impacted by the pandemic. Some students have gone without the mental health and wraparound services that schools uniquely provide. Before the pandemic, and even with a recent commitment to expand the number of school-based mental health providers, on average, there was just one social worker for 716 students. Wow. Like, think about that for a moment. Like, that you are not able to provide that much assistance to 716 students. Like, one person in a year, like, if like normally you want to build a relationship and have multiple meetings with a kid when they have problems, you're not going to be able to fit that into a 365-day like schedule, frankly, a lot of the time. So we do need to significantly expand what we actually have available in terms of mental health resources in our schools. So yeah, big thing there. School-based health centers are proven to provide much needed healthcare for young people, including mental health care. A Yang administration will expand SBHCs so all young people receive the critical care they need. Yeah, big priority, because I mean, Like, young people are the ones who are losing their family members. Like, we are the people who are being kept away from forming those like key relationships, and frankly getting the socialization we need in school. I think there's going to be a lot of trauma that we're going to be dealing with, not just like this year. This is going to be like an ongoing thing for several years. So I think it's a good idea that we try to make a targeted effort to actually making sure that, we get more providers into our schools. So let's now go to our next part: create 21st century mental health rapid response service. As more New Yorkers struggle with lingering economic and social impacts of COVID-19, rapid response to mental health emergencies is paramount. While the NYPD are often called upon when someone is experiencing a mental health crisis, a police response is oftentimes not appropriate, not what is warranted. Our city has already piloted co-response teams, which add behavioral health specialists to police response teams when New Yorkers are in distress. This effort is already promised to scale up in 2021. A Yang administration will dramatically expand non-police responses to those in distress by expanding home stat, investing in community safety efforts at the local level, and empowering neighborhood networks of rapid response providers to get people in distress the care that they need. I love this policy so much. And it just goes to show you, like, there are people out there right now who are truly trying to just smear Yang as if he wants to increase the police force in New York City, when it is the exact opposite. He has committed on the Breakfast Club to a $1 billion cut annually in the NYPD. He has said that right here, you see it right here, he wants to not send the NYPD to as many emergency response cases. Frankly, this being a program that is expected to expand, that is basically the whole defund the police movement. Yeah, some people are like, oh, it's not far enough. $3 billion, or like what Diane Morales proposes, or get rid of it altogether. Completely unrealistic, wholly unrealistic. Like, just, it's not going to happen. Like, you're being lied to, like, frankly, that you can get that budget cut. Secondly, there has been a spike in crime in New York City. There has been a rise in violent crime month over month. We've had a 50% increase year over year. And specifically, this has been hitting our subway system. Like, Yang had specifically said, we will need to reallocate officers from the, current areas that they're stationed at to our subway system. And now the data is proving how there has been a rapid increase in crime in our subway system as well. So yeah, I love this. We need to be sending people who are not going to potentially use lethal force in situations where it is not warranted. And frankly, our police officers are not trained in how to do mental health proper. Like, they just don't. They don't get trained for that long, and they're not covering this to the extent that you need to understand these problems and know how to talk to these people. And frankly, that is needed in addition, because frankly, most criminals do have some level of a mental health problem too. But yeah, like, we need to be making sure that the first action of someone we send to immediately go to respond to something isn't someone who's going to end up killing someone. Like, that is just not what we need. People are not going to call the police if they have that fear in their mind, that, hey, I need help. Or I should say, people are not going to call for help in general if they feel that the help that they are going to receive is going to be something that could potentially lead to someone dying. So yeah, I think this is very important. This clearly shows that Yang wants to partially, not fully, partially defund the police and take away some responsibilities so that they can focus on what their job should be, which is actually preventing violent crime and then solving violent crimes that have already occurred. Especially as we've seen such a rise in hate crime, especially against the Asian community in the city. We need our officers focused on that and not freaking like mental health problems that people are having and potentially not knowing how to react and using violent force. That should be social workers. That should be this program that he's providing. Let's keep going. So I think this is the last part of his page, but he wants to expand mental health support for healthcare providers. COVID-19 has taken an enormous toll on healthcare providers. New York was at the center of the pandemic from the very beginning, and it is our responsibility to ensure that healthcare providers and hospital staff who have had to experience the brunt of the pandemic are cared for. A Yang administration will expand mental health services for all hospital staff at H+H, while advocating for federal reforms to promote mental and behavioral health among those working on the front lines of the pandemic. Again, this is fine. It's an impact community that does need some support. And this is kind of like an increase in compensation a little bit. It's a benefit, but it's something that would be helpful for these people. But now holistically reviewing the whole page on mental health, my one concern is that I just did not see much in terms of general mental health. Like this is for the healthcare providers. You have like something, the emergency response team, you get the kids, but I'm not seeing much of that like proactive general body access. Like we have healthcare programs in New York City, and it is in my opinion that potentially one of the things we can be doing is covering a higher percentage of the cost for mental health services. Because I will tell you personally, from being someone who goes to a therapist myself, a long time I was not willing to do that because it is cost prohibitive. Like I will tell you for a fact, it can range into the hundreds on a monthly basis to go get mental health treatment. And yes, I know there are some programs that help reduce that a little bit, but it's still a barrier to entry. And you still have to then go through all the effort to be able to do the paperwork, to be able to get approved for additional funding for your help. And if you're in that position where you're already mentally stressed out, being able to do paperwork is a really hard deal. Like, if you're able to help yourself like that, it's like you're likely to be in less need of the mental health. The people who are truly in stressed out times and need the help are the people who are the least capable to be able to actually go through the process to get that additional subsistence help. So that is my one area of feedback for the Yang campaign. All the proposals here are good, but I just think he needs to do something that's a little bit more general for everyone. That being said, we're going to go to our next policy, but I'm going to see if we have any questions here along the way that we want to be addressing. Nope, nothing here yet. But it's good to see you as well, Dan. And everyone, please make sure, again, you're sharing so everyone can see the breakdown of Yang's platform. And please post any comments and questions that you have in our chat. I'll be checking them in between each policy. Let's keep going, though. We're now on to racial equity in healthcare delivery. As we were talking about beforehand, there was parts in the other plan in the vaccine distribution that referenced this. Now we're hitting it in depth. So, well, before COVID-19 hit, race-based health disparities in New York City were stark. Black women in New York are 8 times more likely to die on pregnancy-related complications than white women, much higher than the national average. East New York and the South Bronx, 2 neighborhoods that are predominantly Black and Latinx. Oh, he used that term. Yeah, I'm waiting for someone who will call that out because there's controversy on, do you use that term? Do you use Hispanic? Whatever. But it's a little low level deal. But I imagine you will see in some point in the future, someone's going to take a screenshot of that and be like, oh, look, Yang's too woke. Like, it's silly. I will let the communities themselves decide if that's a big deal. I would imagine most people would say the label of how we call it is just not super important. But I let myself get sidetracked. Let's reread that a little bit. So East New York and the South Bronx, 2 neighborhoods that are predominantly Black and Latinx, have among the highest rates of asthma in the city. These gross health disparities are the result of systematic injustices and the failure of our public health systems. On top of already existing disparities in our city, the pandemic has taken a monstrous toll on communities of color in New York City, exposing the fragility of public health interventions to actually reduce disparities in health outcomes. The reality is that solutions to end racial disparities in our healthcare system actually start outside the healthcare system itself. Yeah, probably. I'm looking forward to see how he says it. Ensuring that all New Yorkers have safe housing, access to transit, healthy food in their neighborhoods, and are empowered with information to make decisions that are the best for them and their families are key to reducing racial inequities. That's a good point. You're going to have less disparity in the healthcare system if you have less people who need the healthcare system because they're able to live healthier lives. Let's keep going. At the same time, the system must also shift to meet critical needs. Our administration will build on the progress that many providers, New York City Health and hospitals, and the New York City Department of Health and Mental Hygiene have already made to center healthcare delivery around racial equity. So they want to amend the New York City Charter to make ending racial health disparities the mandate of the DOH-MH. The Yang administration will amend the New York City Charter to ensure that ending racial health disparities is among the primary mandates of the DOH-MH. The leaders that Yang appoints to the DOH-MH and other relevant city agencies will represent the diversity of New York City and make ending racial health disparities a top priority. I am not familiar with that acronym offhand. Let me look that up for a moment. And I will say, Yang, you need to do this yourself. Don't have I guess he did spell it out, but he didn't do the proper way of referencing. So it's the Department of Health and Mental Hygiene. Did he do that before? Am I just being stupid? He did do this before. My bad, Yang. You did cover this. This is on me. So yeah, he wants to have the Department of Health and Mental Hygiene have its charter amended to make ending racial health disparities part of that. And I would say that it's fair. I would say like this is something where it does make sense. You want to standardize it across the board. If certain treatments are not uniform, that's going to end up leading to basic disparities where it's saying, you know what, I'm going to take more precaution with some people and less precaution with others because I'm doing it by judgment compared to by a standard. So I think that is very important. Let's keep going. Let's build a diverse, culturally competent public health workforce. There is abundant evidence that shows that when communities of color are served by providers who they identify with, outcomes are better. A Yang administration will create a pipeline for prospective healthcare providers of color to serve communities of color across the 5 boroughs. With the City University of New York and health and hospitals, we will expand fast-track pipelines into healthcare careers for New York City high school graduates, particularly those of color who are eager to serve diverse communities in New York City if they commit to serve New Yorkers upon graduation. Yeah, no, this is, again, affirmative action. I think we should make it easier for people to get in by making the cost of going into the medical field more accessible by reducing the university fees. But I don't think it should be targeted to say, like, we need to get like the Black community into healthcare. We need to get this community into this job. If you simply have a cultural expression saying provide education and valuing those careers and focusing on making sure all schools are, frankly, at a high quality and that universities are accessible to all, you're going to have that naturally frankly, like equivalent over time. But when you do it like this, there are just going to be natural potential discriminations that people are going to feel like they were excluded from something because of the color of their skin, or people are going to feel like they only got into these programs because of the color of their skin and not their competency. So I don't like this proposal. Let me keep going. Ensure fair staffing ratios. We must guarantee that healthcare workers are not overburdened, particularly those who serve communities of color. With our partners in the labor movement, we will ensure that the city is a leader on safe staffing ratios across the healthcare system. Good idea. You can't have people be overburdened or they're going to make mistakes. And who are, again, they potentially going to make mistakes to groups they might discriminate against. So it's like you got to make sure people are, sufficiently staffed and have the capability to fulfill the standards that we set. So that is important. Staffing ratios. Let's keep going. Expand access to healthcare at trusted providers. Now, more than ever, safety net providers like Callan Lord Community Health Clinic and Planned Parenthood of Greater New York, and that provide trusted services to New Yorkers in need, could not be more essential as part of our city's healthcare continuum. We will expand support for all safety net providers that specialize in healthcare services for LGBTQ folks, immigrant communities, young people, people seeking reproductive health care, and providers trusted by immigrant communities, and ensure that deceptive establishments that prey on women of color, like crisis pregnancy centers, are out of business once for all. Interesting. So I don't know how to feel about that last part of like ending a specific type of business. So like for those that don't know what crisis pregnancy centers are, really, it's a way that a lot of women are like told like, hey, like let's check up on like, are you pregnant? So they'll offer like pregnancy tests and stuff. And then they'll come in thinking like, hey, this might be a place where I can get like an abortion. But the whole way they're trying to like convince you out of doing such. And so, yeah, they do tend to, I guess, prey on women of color, particularly in their business model and trying to convince them not to. But I don't know if that's like they have to go out of business as much as they need to like stop using deceptive marketing. Like that I can agree with. Like if they are lying about their services, that's a problem. That's illegal. But like to just say I want to get rid of them altogether, not sure. But like let's now like think about the holistic plan. So he wants to basically just expand access to these facilities. And I think that is a good thing, and that we should be encouraging people to offer services that are a little bit more, I guess, specialized. But I need to hear more here. So like it sounds like he's gonna just expand the safety net on healthcare plans, which is fine. I like that. But I want to hear more here. I feel like it's just expand access, but it's like it doesn't go enough into detail of how. Let's keep going. Require racial equity competency for all healthcare providers in New York City. Building on the tremendous work of the Center for Health Equity under former New York City DOHMH Commissioner Dr. Mary Bissett, the Yang administration will require racial equity competency as part of teaching and learning at all H+H hospitals available to providers and citywide in partnership with the DOHMH, and a requirement for nonprofit organizations seeking city funding to deliver healthcare services. Good plan. Happy with the education process. Would want to know specifically what they're teaching, but I think it is good to know that there are courses on this, because here's the thing. There are some inaccuracies in medical education currently in how they are taught, that there could be potentially difference in pain like levels, like certain anatomically different things that they try and teach. It's a little out of date. And so having something specifically on this might be able to bridge that gap. But I'd want to, again, know what was being specifically taught, but I like it here. Let's keep going. Expand neighborhood action centers. Over the last several years, the DOHMH has taken a place-based approach to centering racial equity in healthcare delivery. Central to this shift has been the creation of neighborhood action centers in Brownsville, East Harlem, and Tremont. Neighborhood-based one-stop shops that bring together healthcare providers, New York City agencies, and community-based organizations and programs under one roof. In light of the pandemic, we must expand neighborhood action centers to those communities across New York City that bore the brunt of the pandemic. Great idea. I like neighborhood action centers in general. If you are ever on the welfare system, it is a very complicated process to try and get all the benefits that you are entitled to. And so this really helps streamline that process, and the people who are in need of these welfare services are in the most need of having the process streamlined for them. So I like this. Keep this going. Focus on improving Black maternal mortality and morbidity by expanding doula care. Doulas are critical in ensuring that all birthing parents, and especially Black birthing parents, can advocate for their needs during the birth process. The city has made important strides in centering this issue, but this work is far from complete. A Yang administration will expand New York State's doula pilot program by providing direct support to all parents who seek doula care, with one-time grants to pay for this critical healthcare service, and with DOHMH create a pipeline for more people of color to become birth workers and doulas. At the same time, we will continue to advocate for all private insurance and Medicaid to cover doula care for all patients. I don't know enough about doulas to comment on it. I like the idea, I guess, of someone being an advocate for you in the room. Potentially good. I don't know enough about this issue to comment. So I'm going to move on from that. But I think it is important that we help the overall goal, focus on improving Black maternal mortality and morbidity rates. I do think that's an important goal. We want to make sure that we have a uniform process and that there are not racial disparities in healthcare because of a lack of standardization, or simply because they don't have the proper advocates and their pain and suffering is not being properly believed. Let me keep going. Expand NYC care. While we advocate for healthcare for all at the state and federal level, we must take steps in New York City to expand healthcare access using the tools at our disposal. In 2019, the city launched NYC Care, which allowed uninsured New Yorkers to visit one of H+H's hospitals or clinics to see a primary care physician. Now expanded citywide, NYC Care is one step towards expanding access to primary and preventative healthcare. However, as a report by New York City's Independent Budget Office, the IBO, noted, NYC Care is limited in its ability to impact the most vulnerable parts of the city, namely those that have the highest rates of uninsured residents but are not near any public hospital facilities. We will expand NYC Care to New York City healthcare providers beyond H+H and engage in an aggressive outreach campaign with advocacy organizations to connect people without health insurance to this program. Huge. And I want to just tell people, Use this bullet. People are being like, oh, Yang just wants to give you a UBI. He also wants to give you health care. He also wants to give you lower cost transportation. He also wants to give you spending vouchers into the community. He also wants to give you housing. Like, there are so many different things that he is offering. And this is just one of the other ones. It's like, this is a big deal. Like, making sure that everyone is covered with health insurance is a big deal. So I fully recommend, go take this screenshot, go share it with people. This is a big deal. So I am very happy with this plan to make sure that we can expand care even when the state and federal levels are dragging their feet. Let me check back in. Let's see. In general, yep, I agree with you, Brennan. Back when we were doing the mental health part, we do need to do the general mental health in general. So yeah, I would hope Yang, if he ever sees this, he'd be like, okay, let me add a little bit more onto that. That being said, I'm going to keep going. Got green reinvestment in NYCHA. And again, reminder, everyone, feel free, go share out the video. And as well, make sure you've hit all those like buttons and that you, frankly, are sending us your questions because we want to answer them along the way. But let's get going into this. So, with 1 in 15 New Yorkers calling NYCH a home, New York City Housing Authority, we cannot delay the crucial changes needed to bring NYCHA into the future. For too long, our city's public housing residents have had to live in unsafe, debilitating conditions. A Green New Deal for NYCHA would restore dignity in public housing while saving nearly 500,000 units of affordable housing from falling beyond repair, creating hundreds of thousands of jobs, adding billions of dollars to our local economy, and bringing resiliency to the forefront of our city. The New York City Housing Authority is home to 400,000 New Yorkers. The system has faced decades of divestment and disrepair. Crumbling infrastructure, a backlog of repairs, rampant mold, and lead poisoning have resulted in health problems, psychological strain, and poor quality of life for NYCHA residents. Compared to the city average, NYCHA apartments have twice the rate of cockroach infestations, heating breakdown, broken toilets, and water leakages make NYCHA residents twice as likely as the average New Yorker to face health challenges. As mayor, Andrew Yang's top priority will be securing $48 billion in needed federal funding from the federal government over the next 10 years to make repairs and capital improvements, ensuring that all improvements to the system are aligned with environmental standards. To be fair, I think I believe him that this is the actual top priority of the campaign. I know he's talked about this on multiple occasions and how, frankly, one of the things that, well, to be fair, probably number one priority of the campaign is getting COVID under control. But priority 2 is this, because he talks about this a lot and how his biggest advantage as a candidate in this race is his federal connections and how he has been lobbying Joe Biden to make this investment into New York City. Do I think the Biden administration will do it? Probably not. I see Biden fearing like it's like they're just sending money to the blue state, and he's the classic like, I gotta appease the Republicans too, so can't make it look like that. So the only way that's gonna happen is if we can get like a major infrastructure bill passed, and I don't know, they've been dragging their feet in terms of leading on legislation a bit, so I'm a little skeptical, but I trust that this is a priority and that he will fight for that. And that it is important that they get that money, because he is right. It does not do much good to have public housing if people don't want to live there and it's causing them to be unhealthy. That is just a waste of money in my mind. We need to provide quality public housing if we're going to invest in public housing. Let's keep going. Now is the time for transformational change. NYCHA tenants should have to wait no longer to live in safe, sustainable, and quality public housing developments, but we need to do so much more than the bare minimum. My administration would launch NYCHA into a green revolution, using the once-in-a-generation funding we will get to make sustainability, resiliency, and livability the standard in public housing. One other thing I should note about this that is beneficial too, is that you might be thinking like, oh no, this is just investing in only the public housing. Like there are so many people who would be excluded from this benefit. As he said, only 1 in 15 people live in the public housing. But this will also do another good thing for those people too. It's going to really increase the rental prices of their area. The housing prices of their area are going to be, the value of their homes are going to be increasing. The value of their apartments are going to be increasing because you're going to have a little less blight in your areas from these areas being cleaned up and looking less like a sore thumb in the area as well. Furthermore, like on top of that, you're going to have significantly less cost to your healthcare programs in the area because people are going to have less health problems. You're going to have less crime in your area. Like there's going to be a lot of good things that just come from rebuilding these structures so that they're not a blight on communities. Keep going. Full capital investment in NYCHA. The Yang administration will fight for $48 billion for capital repairs from the federal government. The New York City Housing Authority has struggled through decades of divestment. Expected repair and costs now total $32 billion over 5 years and $46 billion over 20 years. The Yang administration would use its deep relationships in Washington, D.C. to fight for at least $48 billion in funding to cover NYCHA's full capital need and set NYCHA back on track while also investing in local solutions to make repairs and improve standards of care for public housing tenants. I like this. It's good that he actually gave these numbers because now it lets us understand that he's actually trying to anchor the $48 billion as his thing and is kind of more realistically trying to get into that $32 to $46 billion range from them. But he is going to negotiate in a smart sense by asking for more and then getting a little bit less. And that's actually what he was targeting. So let's keep reading. Bring a Green New Deal to NYCHA. We know that any chances we have to make significant upgrades to the NYCHA's buildings will be a once-in-a-generation opportunity. So we must capitalize on these investments by ensuring all capital improvements are aligned with our sustainability and climate goals. We will usher in not just upgrades to NYCHA buildings, but also a new era of racial, economic, and environmental justice. New York City recently passed bold legislation, the Climate Mobilization Act, which requires most buildings to reduce their emissions by 40% by 2030 and 80% by 2050. Although NYCHA does not face the same penalties as other landlords if it does not comply with the law, NYCHA can still lead on progressive decarbonization efforts. This includes passive housing standards, energy and water efficiency, electrification of fossil fuel-based heating systems, and investments in renewable energy and clean jobs. Agreed. Like you're only going to do this rebuild once, likely. It might be stretched over time. Probably some of it will occur not during the Yang administration. Like it'll occur, as he said, like over 5 or even like 20 years. But we need to start. When you're going to do this big refurbishing effort, he's right. It's a once in a generation thing. You don't just do that over and over and over. It just doesn't happen often. I agree. We need to get it right this time. So let's see the plan. Abolish NYCHA's carbon pollution by eliminating gas from all NYCHA buildings, reducing energy use, and procuring electricity from 100% renewable sources. A Data for Progress report indicates that these actions would cut NYCHA's annual carbon emissions to zero by 2030, a 2.3 million ton reduction of carbon per year, which is equivalent to taking 453,243 cars off the road. That's a cool stat. There's no issue I see with this. We should be moving all of our gas, like stoves and such, and heating elements to electric based. That's a good plan. Accelerate deep energy retrofits, such as upgrades to windows, the building's outer cladding, and its core energy systems, which would also reduce multiple drivers of mold and pest infestation. This will require appliance upgrades such as heat pumps, new stoves, leak-proof low-flow toilets, and new fridges. Good. Again, energy efficiency. It's not necessarily that he's saying like, oh, these have to be like the nicest apartments ever, but like, yeah, let them be efficient and not like absolutely shitty. There is a balance. Let's keep going. This will have major impacts in terms of cost savings. Smart retrofits will both improve resident quality of life and help NYCHA realize dramatic utility savings over time that would improve NYCHA's long-term financing. Other cities which began retrofitting over a decade ago, such as Toronto, Boston, and Paris, have realized 20 to 40% carbon emission reductions that resulted in energy savings in their public housing developments. New York City can do this too. Estimates show that a Green New Deal for NYCHA would save 35 to 70% of current energy costs, realizing 100 to 398 million a year in savings. Yeah, so that's like one of those things. It's like, if you want to make savings over time, you got to make investments so that you run more efficiently. And so, yeah, it's great that it's kind of in a green sense, but it's also an economic saving too. So it's like, yeah, we're investing up front and we're going to spend money and that is going to cost something, but we will obtain savings from this that we can then pump into other things later on. Let's keep going. So they want to retrofit. Purchases can harness the market power of the public sector, reducing costs for others. As Data for Progress points out, bulk public purchases of the best new appliance models could drive down costs for everyone in the market as well. Other public agencies or community groups could also piggyback on these bulk purchases to secure low-cost appliances for their members. And there's precedent for city government using its convening power to lead product development and bolster demand for new technology. For example, in the 1990s, NYCHA and the New York Port Authority did just that with a contest to find an efficient refrigerator model, which resulted in Maytag producing the first Energy Star fridge sized for apartment living. That's a cool idea too. Like being able to drive down cost savings for people by buying in bulk from the public sector is a great idea. And to be able to have the potential for kind of contest to drive efficiency matters is kind of cool as well. So it's a lot of it's pretty intersectional here, and that is like it's going to help business here. It's going to help people who are living in the houses live a better quality of life. It's going to save the city money. It's going to save the neighbors who don't live in the public housing. It's going to help their property values rise. Like there's a lot of good things that are going to come from just simply the retrofitting aspect of it. Okay, they'll commit to putting solar on every NYCHA roof by 2030. Yeah, I mean, this is just like an obvious thing. It's like you got the real estate, use it. And likewise, I think it was the plan to make things like more fun. I don't recall specifically, but I remember in one of the policy breakdowns that we had done in the past 2 days, he had basically said that we should be painting rooftops I think lighter colors so that they reflect more heat that's coming in. So it's like having the solar panels would help absorb some of it, and then you have that reflection. So it's like another quality of life thing too, in addition to producing more energy and green energy at that. Okay, so providing cooling as a right to every NYCHA resident. Heating as a right is a requirement in all New York City buildings. As the climate warms and we experience more heat waves, every resident should have access to air conditioning in their home. Last summer, the administration began efforts to reach out to the NYCHA tenants under the city's Get Cool New York City program, which was slated to deliver 22,000 AC units to NYCHA residents. As of June 2020, 1,900 units were installed in NYCHA buildings. Electric health pumps, which will be installed to replace natural gas and oil steam boilers, will provide both heating and cooling. So, yeah, as I said, part of it is also the cooling element to the actual units. And I mean, like, yeah, you would be surprised at how many apartments in New York City, even beyond the public housing supply, lack AC. Obviously, they don't have authority over those other buildings to like put AC into them like they do with NYCHA. But it's something to consider. It's like, how do you incentivize, landlords to update their apartments to provide that? Because I think every apartment in New York City should have that. Because it is, although it is very cold now, hence this, it is very hot in the summers. So I highly recommend, and not just hot, humid too. So I highly recommend that we do efforts to cool everyone down and expand AC. Invest in clean jobs and economic development. The Green New Deal will create up to 325,519 jobs in New York City over 10 years, which according to Data for Progress, which would result in a citywide economic impact of up to $96 billion in local economic activity over a decade. Priority for installation training and jobs will be given to NYCHA residents for these high-skilled, high-paid union jobs. So I always have like some concerns when we get like the very specific like job numbers, because it's like, yeah, you might be creating like these new jobs, and that might be how much workforce is required to make all these updates. But it's not necessarily saying like we're going to have 325,000 people who were previously unemployed get a job. Usually it's like, well, someone moved from somewhere else to this job. So it's a little bit maybe potentially misleading. I'd have to see like how they came up with that number specifically. But I do know that that is often a misconception with a lot of the jobs numbers that they will post of like what programs will create. Is they usually will just report what is going to be required as labor for the jobs that they want to do. But they do not consider that it is not net new jobs. It is like just jobs that have been created. Let me keep going. A Yang administration will also invest in job training for NYCHA residents, especially in green jobs. Green City Force has done incredible work to engage young people who live in NYCHA and are out of school and out of work. Critical professional development and apprenticeship style training to rehabilitate developments with a focus on energy efficiency and access to food. These are exactly the programs we should be connecting young people to after this trying time and are generously funded by private groups and city dollars. The Yang administration will work with philanthropists to expand this funding and bring these resources to as many NYCHA developments as possible. Yeah, it's a good idea. Just we want to incentivize people into these general jobs. We should have to train them and incentivize them. Yep, makes a lot of sense. Let's keep going. Rid NYCHA of mold and lead. Yep, we don't want those things in our building. They are bad for our health. Let's see. Create a healthy and safe environment for every NYCHA resident. Federal and city law requires NYCHA conduct mandatory safety inspections for lead paint and submit documentation to HUD showing compliance with the law. But in 2017, the Department of Investigations released a damning report confirming that NYCHA had been lying for years about its lead paint inspections and actually was falsifying, certifying its compliance and documents to HUD that has put thousands of children at risk. Another reason we get to say fuck de Blasio, right? Like here we are. Yeah, that's despicable. Lying about lead in your paint, God. Like yesterday, we got to do a whole live stream, like complaining about Cuomo, but it's like, you know, we can see like there's been this crisis like in Texas, and everyone's been pointing and saying like, look at these Republican failures of leadership. But boy, like we don't do a great job in our like Democratic leadership too. I'm not going to say it's as bad, but like we should have such higher standards for our leaders. And at least de Blasio was routinely hated in New York City, but like, boy, like they really get away with some real criminal shit. Okay, let's keep going. We continue to witness the irresponsibility and toll this has taken on children, mostly of color, who reside in NYCHA by completely eliminating the root cause of mold. A Green New Deal for NYCHA would reduce the high rate of asthma among NYCHA residents by 18 to 30%. Allowing residents to see increased health benefits, which will save lives and the city money in healthcare costs. That is why a Yang administration supports the creation of a mold ombudsman. As a result of ongoing litigation, a federal judge has appointed an ombudsman to assess NYCHA tenants' complaints about leak, mold, and exposure and excess moisture repair orders. Because the ombudsman has the power to compel NYCHA to make repairs, it is an effective tool, but the court order expires in 2021. Under my administration, I would follow this model by appointing a permanent independent ombudsman with legal authority to investigate, bring charges, and compel repairs. More than this, residents need to know the ombudsman exists. Our administration will dedicate resources to conduct tenant outreach, ensuring that all NYCHA residents utilize this enforcement tool to their advantage. It's good. It's good. We need to make sure that people aren't getting unhealthy. Frankly, it's also a reason why we have a mental health problem in this country because, well, that's what lead and mold will cause. Well, mold is more the respiratory, but the lead, that's going to create mental health problems in this country. So, highly agree with him. We need to make sure that every unit is a safe place to live. Otherwise, we are being negligent in our job of trying to actually provide housing. Right? Most people might choose to not take the public housing if they think that is what they're about to go into. And so if we really want to address homelessness, we have to make people want these public housing units and we have to make sure that they're efficient and that we can build more of them because they're actually appreciated in the communities that they take place in. So I love this, and we're going to go into more NYCHA policy in a moment. I want to take a time to check the chat. Let's see, what do we have going on so far? So that's for sure. Let's see here. So Andrew Yang's top priority will be to secure $48 billion from the Fed to make investments and repairs at NYCHA. Or any of the other Congress Democrats talking about doing this for all cities yet? Yeah, I mean, kinda. This is what the Green New Deal is. So it's an infrastructure bill. It is a little bit toothless in that it is a resolution, but that is what it's intended to do. It's to say this is our responsibility to rebuild this country, and then there'd be subsequent bills to come afterwards. There have been some ruminations of infrastructure talk, but there have not been any major bills proposed so far. So I would not hold my breath on that. That'll occur. But who knows? And I mean, we have a shot. At least we have the control, and Democrats hypothetically support infrastructure. So we will see. But I am cynical for now because it is not getting enough serious talk. Let me see. Was there any other questions? No, there was not. But thank you for the question, Brendan. Let's keep going. Let's continue to talk about now the expanding resident democracy at NYCHA. This is going to be probably a very interesting one because I've not heard a lot about trying to do democracy within our public housing, but I want to see what he has in mind. So the New York City Housing Authority is home to 400,000 New Yorkers. In spite of the city's various attempts to have the authority to weigh in on decisions that impact their lives, NYCHA has fallen short to substantively expand resident participation and democracy. More residents on the New York City Housing Authority Board. NYCHA is governed by a board of 7 members appointed by the mayor, including 3 NYCHA residents. Members' duties include voting on contracts, resolutions, policies, motions, rules, and regulations at regularly scheduled meetings. A Yang administration will advocate for a change to state law and expand the NYCHA board to a total of 11 members, 5 non-residents, and 6 residents, who can substantively inform the work of the agency by expanding the governance structure and size of the NYCHA board. Tenants will have the opportunity to substantively shape the agency's decisions. Okay, so now I have an understanding of what he means. I would change the wording on that a little bit, like maybe it's not 5 non-residents, but it's just 5 any New Yorkers, and then there's 6 required residents. Because I think some people might take the word non-resident in the context of not just NYCHA resident, but New York City resident. So wording change, but it's a cool idea. I mean, yeah, you should have the people who are living there have some say in how it's managed, frankly. I mean, I guess technically some people would say you get to have some authority over who you elect as your elected leaders, and then they would have some authority over who gets to be a part of the NYCHA. But I believe we should be having, in general, some more direct democracy measures into our quality of life. And this seems like a good thing to have, in my opinion, so far. Let's keep going. Make the most use of tenant participation activity funds. Interesting. Tenant participation activity funds are funds provided by the United States Department of Housing and Urban Development to support resident engagement and meet community needs. The funding can be used to support activities that range from skills training programs to office supplies in support of resident council functions. One of the many functions of NYCHA resident councils is to determine the use of TPA funds to plan tenant activities. Unfortunately, as many as 1/3 of NYCHA developments do not have functioning resident councils, which leaves the sorely needed funding in languish. In a 2016 City Council Committee on Public Housing hearing, NYCHA testified that it accrued approximately $13.5 million in unspent TPA funds before 2016. Shameful. They're just holding up the money. Just freaking spend it. Ask them how it wants to be spent. I'm totally getting why Yang wants this now. The fact that they're just holding back money that they've been allocated makes no sense to me. A Yang administration would prevent these funds from going unused by appointing a community-based organization chosen by residents to provide services to NYCHA developments, including overseeing the allocation of TPA. In a situation where there is no resident council, CBOs would be required to administer TPA funds through participatory budgeting process that resembles the best practices already piloted citywide and previously proposed by the city council. This will ensure that all NYCHA developments have an opportunity for resident democracy to thrive with the resources allowed by HUD for use, consistent with residents' needs. Yep, makes sense. Reducing allowable overhead of TPA funds. HUD allocates annual TPA funds to NYCHA based on a formula of $25 per unit of occupied public housing. But NYCHA takes up to 40% of allocated funds, $10 per unit at full subsidy, and uses the money to administer the program. In a city that currently expects nonprofit services providers to only allocate 10% of their costs to indirect expenses, the city should be a model in efficiency. A Yang administration would ensure that the NYCHA takes no more than 10% of TPA funds to administer the program, putting more resources into the hands of residents. Love that. Like, this is big. Like, in my head, like, if you want government to be able to expand over time and do all these different programs, we have to show they're efficient. Like, that is at the end of the day such an important part, because so much of the opposition of doing government programs simply from the right is that they're just inefficient compared to the private market. And you know what? In some cases, they're right that they are inefficient. And so what do we do about that? Well, you have the right, which says give up, just get rid of it. And then you have us, which is like, oh, let's do a better job. And we can do a better job. So let's do it. So let's go to our last point here. Prohibit luxury infill development and require all projects on NYCHA land to adhere to ULURP. Infill at NYCHA is no way to raise the level of revenue that the system needs. There is currently no public process accessible to residents that allow residents to determine how land on their property is utilized. In addition to prohibiting all luxury developments in NYCHA property, a Yang administration will require all development that is being considered on NYCHA property to go through the uniform land use review process. I apologize for not having enough information on what that process is, but I kind of, if it's doing something to try and prohibit luxury development at the properties of public housing, I can assume it's probably a good process to adhere to. But I'm going to do a little bit more research myself after this to look into what that policy is, because I have not heard of that one before. So I will have to go look into that more. But now I'm going to take a quick check before going into our final policy section. Yeah, no, no questions yet. Let's see what he said here. Brandon again. Spoiler alert. The dates don't line up like your ages and wants. We millennials had the worst lead levels in our blood while we were growing up than any other generation. I wouldn't say I'm ageist per se. I certainly have empathy for my fellow millennials. I am the youngest version of a millennial. I am at the very tail end, so I have that connection with the Zoomers too. But you're right that frankly, well, it's probably more so like the older millennials than it is like the second half of the millennial generation as much. But yeah, I would have to see this. I don't know if this is an actually true stat. Like I see some people are like, we need a source for the claim. I don't know enough about that, but there had definitely been some deregulation efforts on like lead paint in like the 80s. So I wouldn't be surprised, but I'm not going to claim that's a truth. But it's interesting to look into. I highly recommend some people consider it. But let's go now to our final policy. We're going to be talking about a People's Bank of New York. Okay, our city faces a crisis in banking accessibility. New York City is the world's leading financial center. Yet, over 350,000 households, almost 12%, have no bank account. That is 50% higher than the national average. Another 780,000 city households are underbanked, meaning they have a bank account but still rely on non-bank providers or of alternative financial services such as, check cashing services, prepaid debit cards, and high interest loan services. And then households that rely on such services pay high fees for even basic financial transactions, an average of over $600 per year just to cash checks. Yeah, that's crazy to me. You're not getting paid a great wage right now in general, unfortunately, in this economy. And then you're having to spend even more on the fees to even get your freaking check processed. That makes no sense to me. And yeah, it is kind of like a weird irony that in literally the financial center of the world, 12% still do not have a bank account. And he's right. Part of that is the fees, but also part of it is sometimes banks aren't willing to take people because they have bad credit. And that is very unfortunate. And the credit system is not like this, super long ago, we've had it forever system. This has been something that's been since our parents were basically born. That this has been in place. And so, for that to be a reason for someone to not have basic banking services is crazy to me. And so, yeah, a public alternative is going to be a great deal of help. And it is also going to provide competition into the market as well. And it's going to help a lot of the discrimination that's currently within banking, like redlining, to be mitigated in addition to that. So let's keep going. I'm sure he's going to cover this too. So simply put, being unbanked is an extra tax on workers and families that is imposed disproportionately on people of color living in low-income neighborhoods. Correct. Being unbanked carries other less obvious costs. Customers using AFS services, let me read that again. Customers using AFS products rarely build credit, which is essential for accessing fair loans, credit cards, and rental leases. Another very good point here. Unfortunately, our system basically says, go take on debt if you want to have a credit score so that you can get basic things like, an apartment, because now landlords will check your credit score. And I get it. You want to make sure that they're going to pay you and then you're not going to have to go through an eviction process and all that. But it's keeping people from having basic goods, and we need to have a public system that provides so that these private groups who might not feel like they have the risk tolerance to do it aren't having to take them, but these people are still being banked. So highly agree with him there. Let me keep going. Being unbanked also disincentivizes saving, since AFS costs rise quickly when consumers try to save larger sums of money. And during a pandemic, being unbanked can be physically dangerous since you can't cash a check remotely. Yeah, this is also true. I know personally I've had people who have been asking me for money who have struggled because they don't have a physical bank. And they have been having trouble actually cashing the mutual aid money that I've been sending them. So yeah, this is a problem. Let me keep going. But expanding bank access is no simple task. That's because a wide range of obstacles keep New Yorkers from using bank services. For example, some households, particularly undocumented ones, lack the identification needed to open accounts. In other cases, banks' high overdraft fees discourage low-income workers from using checking accounts. Mainstream banks often have few branches in low-income neighborhoods where they struggle to operate profitably. Makes sense? At the same time, there is a stark racial and income-based disparities in how entrepreneurs access capital. Low-income entrepreneurs often struggle to access financing to launch or grow businesses because by banks' conventional credit metrics, they appear to be higher risk. That's one reason that while 22% of New Yorkers are Black, only 2% of small businesses in the city are Black-owned. That stat makes me question a comment that I made before. We were saying how we wanted to encourage minority businesses. And I kind of get that now. We've been building this system that is just disenfranchising communities of color from being able to participate. And it's often due to things like credit access that are institutional in nature. And the lack of a public banking has basically enabled that. So maybe it is kind of it's a catch up. It's like a form of justice rectifying it. I'm conflicted. I'll have to think on that one a little bit longer. But let's keep going with the analysis of the public bank. To address these challenges, a Yang administration will launch the newly created People's Bank of New York City. The People's Bank of New York City will initially be funded with a $100 million loan from New York City. The People's Bank has two objectives. One, ensure every New Yorker can access basic financial products and services like checking accounts and has the opportunity to save money affordably, build credit, and secure small business loans. And two, support small business lending in underserved communities by guaranteeing loans and loan portfolios. The People's Bank will complement the work of the existing community development financial institutions, the CDFIs. These credit unions, community banks, minority depository institutions, and loan funds already know the needs of their neighborhoods in which they operate and have built strong relationships of trust over many years. The People's Bank can be launched by New York City without new state legislation. By launching the People's Bank early in his mayoral administration, Andrew Yang will build the case for a true public chartered bank that can ultimately offer a broad range of direct financial services, both to the city of New York and to its people. Yeah, I mean, is a good point. Like we gotta start it early. We gotta already work with these groups that are kind of community-led financial institutions to make sure that we understand what areas are needing more help, because they have a lot more data analyzing those communities. Let's keep going. So activities. Specifically, the People's Bank will expand access to banking services by, one, providing growth capital to CDFIs, which they can use to offer a larger range of services in more neighborhoods at better costs. Launching an innovative lab to arm CDFIs with best-in-class financial technology and bring the benefits of fintech products like mobile-first banking to more consumers. 3, creating a new People's Bank certification from financial institutions in New York City that offer basic banking services with appropriate guardrails and commit to accepting NYC ID for purposes of opening accounts. That seems pretty good to me. It's basically saying like we're going to start off by helping, some of the existing financial institutions that have been built out, setting standards for other banks to come into the process by accepting NYC ID, and then launching some innovation to try and bring more tech to the CDFI. Let's keep going. Increase small business lending to underserved communities by providing loan guarantees for traditional small business loans originated by CDFIs. And 2, by partnering with CDFIs and mission-oriented technology companies to extend microloans under $50,000 to entrepreneurs that would otherwise be unable to access financing. Like, I fully support this, but I'd be kind of curious, like, what their process will be as like a threshold of like what will still need to be like, established as something to do. Because 50,000. I'm doing quick math in my head. Let me actually just do the actual math using this. So it's like 100 million divided by 50,000. So that's 2,000. So you're basically saying like, what if 2,000 people apply for this? Wait, did I do that wrong? I think I did that wrong. Let me see if I did that wrong. Oh, I did 100 million. Yeah. So if like 2,000 people applied for this program, you'd run out of it, and like you're spending on other things. So it's like, I imagine there has to be like some criteria. And I'm sure this is basically like, he wouldn't necessarily lay it out here. He'd be relying on those groups that we talked about beforehand. Like he would be looking to work with the CFIs and the MDIs to try and make some of these determinations. But like that is going to be the main pushback against a lot of this is going to be like, well, you just want to guarantee loans to everyone. Like, how are you going to know if it's a good investment? How do you know you're not just losing our city money and like wasting it on these small businesses that aren't supposed to be getting loans because they're not good ideas? So in my mind, what I actually see is a better potential plan is we should have like some maybe equity stake, that it's not just a pure debt thing, but it's like an encouragement of being able to construct more private-public partnerships. But I digress. I want to read more of what he has here. So this model incorporates best practices from other programs. For example, the Bank of North Dakota, the only state-run bank in the United States, has used this method to foster the densest community banking network in the country. It is a good banking network. I will admit to this. Finally, Mayor Yang will direct his administration to encourage recipients of benefit payments, starting with universal basic income checks, to open certified safe bank accounts and activate direct deposit immediately. Certified safe accounts come with no overdraft penalties and other benefits and are already available for more than half the nation's banks. At virtually no cost, the city can intentionally use its role as a disperser of benefits to derive greater financial empowerment. This is a great thing. This is one of the reasons why it's actually very important to have a public bank and make sure that those other 12% of people who are unbanked right now actually have a bank account. It's because, well, if you want to deliver a benefit like universal basic income, how do you do it? Like, if someone doesn't have a bank, you're gonna just have to do the checks and send it out like a physical payment. It's gonna be difficult. Especially if you want to do like quick stimulus and it's like people can move. So it's like, it's a little bit more difficult. But if you have a bank where you have these accounts specifically for them, I think you're going to be in a good position to know that you could just send it to that account and they're going to get it and they can access it. And if they want it sent to another bank, you can just have it route through the public bank and say, hey, okay, I got my money here, have it transferred to my other bank that I have that maybe is paying me a better interest or something like that. So yeah, I think this is frankly, in my opinion, one of the most important reasons why we have a public banking system is just so that we can very easily send benefits to people. Let's keep going. Benefits for community institutions. Community institutions are at the forefront of our city's fight for financial inclusion. A Yang administration will support them, not compete with them. Interesting. Here I am thinking he is going to compete with them. Okay, let's read more. Growth capital. Loans and loan guarantees by the People's Bank will help CDFIs get the funds that they need to grow and expand. This support is all the more important under COVID-19, which has stalled small business lending markets and dried up bank revenues. Okay, so it's kind of going through the CDFIs for the growth capital. Okay, so discounted retail space. Where possible, the People's Bank will also work with the city's other agencies to offer discounted or free rents to CDFIs that want to open new branches in underserved neighborhood programs and similar services for disadvantaged New Yorkers. Okay, so I'm getting more of the model. So it's not like he wants to create a necessarily like separate investment wing. He wants to basically use like a public institution that has like basic checking accounts available to people as like one part of the actual public bank. But then the investment wing of the bank is really taking money and then flowing it through these CDFIs. Interesting. It's probably a good plan. Like, I think that is going to end up, at least in the short term, being a better plan. And like, it can be addressed later on if you want to just fully own it from the public side instead of going through the community development financial institutions. But yeah, I think that is probably the better approach. Let me keep going. Discounted retail space. Where possible, the People's Bank will also work with the city's other agencies to offer discounted or free rents to CDFIs that want to open new branches in underserved neighborhood programs and similar services for disadvantaged New Yorkers. Technical support. Technical support made possible by the People's Bank will ensure that CDFIs have the best tools, technology, and business plans, which will help them attract new customers and expand operations. CDFIs offering high-quality products will also receive People's Bank certifications, deepening the trust their community places in them. In sum, the People's Bank of New York City will contribute to a vibrant, community-focused financial ecosystem that benefits workers and families, entrepreneurs, and small businesses and CDFIs alike. Cool. I like the plan. Let's see. I know he made this whole white paper. I don't want to go too much into depth, but I just wanted to make sure you all are aware of it, and we can do a brief scroll through it. It's basically going to be very similar to exactly what we just read. It's just kind of like a PDF, nice looking version of it. Yeah, like I'm just trying to see if there's anything in here just by skimming that is any different than what we've already read. No, so far it's seeming like the same thing, but just presented in an even prettier way. Yeah, there's nothing new in it. So you don't even have to read the white paper. It's just if you want to like send instead of this page something that looks even nicer, you could send the white paper. But that being said, my friends, that is all of the policy for Yang's platform. It has taken us like nearly 4 hours to do it all. Yang spoils us in that respect, but I'm very glad we got to go through it and provide a little bit more clarity of how we feel about it, questions that we have remaining on it. If Andrew Yang ever watches this series, I hope you enjoyed the feedback. It's okay we disagree. I support you, my man. I'm going to see if we have any final questions before we wrap up. And then we're going to call it a day. And we'll kick off the other candidates on Monday. So let me check that out. Got another question from Brendan. I love the questions, Brendan. So question is, can we look at any other high population cities that have done this outside of North Dakota? I wonder what the evidence shows on the impact. So yeah, a lot of places in Europe actually do it. So I would highly look for that. Like go actually look into public banking. We don't have a ton of it yet in America, like public banks. North Dakota really is that prime example. But we do have things like the CDFI. So I highly encourage you, go look into public banking. You will find a lot more of it outside of America because as you can understand, America is pretty capitalistic and that usually starts with the financial institutions. But that being said, I want to thank you all for coming today. We're going to be having new episodes out, as I said, for this live stream on Monday to cover the other candidates. We're going to have a new podcast coming out this Tuesday. It's going to be a conversation on democracy reform with our guest, Adam Christensen. That was an awesome conversation. Like, awesome. I always love talking to Adam Christensen. And, you know, for the few people who might be watching this right now live or who watch this later, I will tell you, of all the candidates I got to interview in 2020, he was one of my favorite to have on. So I highly encourage you to come listen because the thing that I think he does best, he's a very smart tactical thinker. And when it comes to things like democracy reform, tactics is everything because inherently you have these corrupt people who have been able to succeed in the existing system who don't necessarily want to change the system because they succeeded. And we still need these changes to get proper representation. So it's all about tactics at the end of the day with democracy reform. So tune into that on Tuesday. Check out the live stream we did last night. We had our first team live stream last night. We basically slammed what was happening in Texas and the handling of it by Republicans, as well as we had slammed Andrew Cuomo in New York for his handling of the nursing home crisis. That was a really fun conversation we got to have with Brianna Cardenas, Jackie Sawicki, and Michelle Rosado on our team. So go check that out on our YouTube page. And then finally, we had articles that came out this past Thursday. My first article personally came out on healthcare and single payer plus, and you should go check that out at thehillofroses.com. But with that being said, my friends, I want to thank you all for tuning in today. I had a blast being able to go through the platform, and I look forward to seeing you all again on Monday. And go join our Discord community as well. We would love to see you there as well. Okay, everyone, have a great day.